to review the Precision Point P88, just to kind of give you an overview on the test. The first 2 pages basically show you all the different pathways that are tested. Please understand that they do not influence each other. The E-mediated, IgG4, and IgG, and then the complements. So it kind of gives you an overview, like, for example, if a food has more than one pathway, it would obviously be scored higher when you go down to the next few pages. They are independent of one another, and you can be sensitive to one pathway, to all, or none. So that takes you to the next page, which then lists out the reactivity in a list to determine how you want to tackle this. If you're very symptomatic, this might be too lenient for you. Now, if you go into the immune index, this is really nice. The algorithm only generates a list from the most reactive to the least reactive food that emphasizes just the complements and de-emphasizes IgG4. Now, IgG4 is very unique here. So that's here. So it says provider's discretion. It's very unique to people who have specific IgG4 related diseases or IgG4 RDs, and that could be things like Hashimoto's, PCOS, endometriosis, and other autoimmune conditions. Now, complement is interesting because what complement can do is it can amplify a response, usually the IgG, by 1,000 to 10,000 times. And it's associated with the innate and adaptive immune system, which then activates and recruits cytokines. And so this page is emphasizing that. So by removing foods from the immune index here on this page, you could be reducing inflammation that's associated with these inflammatory cytokines. And the more you remove, the more you can reduce. Now, keep in mind also with these foods, it's okay to consume the oil, not the food, because the oil will be void of the proteins. And this is testing for proteins, not peptides, proteins. And it's not likely to have a response, but that will only apply to refined oils, not unrefined. So this page is interesting because it lists out the different types of foods, reactions outside of the immune reaction. And so obviously, if there's a letter here, it shows that you're showing a food reaction as in addition to immune, but also these other types of reactions. So almonds, for example, are a salicylate and also an amine. They're also high in oxalates, but you also had an immune reaction to it, so it was highlighted. Bananas is a FODMAP, but it's kind of nice to be able to see, hey, listen, maybe you shouldn't eat almonds for this person. It is listed here as, for example, restrictive and also the less restrictive. So almond was listed. The almond is giving you an immune reaction with the cytokines. And then on top of it, it's also an amine and a salicylate, probably good to avoid. Calm down your immune system. If you show up that you have fungus, it probably means it's residing in the gut. So there's some dysbiosis, imbalanced bacteria, which makes sense considering the symptoms. Same goes for aspergillus. It just indicates that there could be some dysbiosis. So here you go your aspergillus, IgG4. So the presence of these things in your gut can trigger an autoimmune response. And you could develop, if you haven't yet, some type of IgG4 condition. So it's important to modify your gut microbiome. Okay, that's it. Thank you.